You feel like I am cold or indifferent. You are wrong. I am objective. And in the world of immigration law, objectivity is the only thing that will secure your future. There is a paradox at the heart of every immigration medical exam. You are the patient, but the United States government is the client. This is the hardest reality for applicants to grasp. When you visit your primary care physician, the loyalty is to you. Your doctor is your advocate fighting for your health, but when you enter my office, the hierarchy shifts. My loyalty is to the integrity of the process. I must maintain strict, unwavering objectivity. This can feel cold, even indifferent, especially when you are dealing with the high-stakes pressure of an immigration application. Let me be clear, I am not indifferent to your stress. I am indifferent to the things that do not matter to your application. To understand this, we must look at the specific data points required by federal law, the forensic markers of your medical history. The USCIS defines the civil surgeon as a forensic examiner, not a treating physician. This is Rule 702 territory, a matter of BLAS. We do not diagnose to treat, we audit for admissibility. This distinction is the bedrock of your clinical forensic journey. In the matter of BLAS, the Board of Immigration Appeals clarified that civil surgeons are experts providing technical data. We operate under Rule 702. We are effectively expert witnesses for the government, auditing your biological terrain. This is why sentimentality must give way to data. My tone is intellectually aggressive because the stakes are high. I am a clinical commander. My mission is the integrity of your file. The law requires a forensic audit of 3 primary pillars. Let's deep dive into the first, Class A and Class B communicable diseases. We are auditing for public health threats. An IGRA positive isn't just a clinical finding, it's a legal gatekeeper. We look at the biological soil. Tuberculosis screening has shifted to IGRA testing. We don't care about your narrative of it was just a positive skin test. The lab-verified data is the only truth. Class A conditions are an absolute bar to admissibility. Class B requires follow-up. Our audit distinguishes these with sub-millimeter precision. Our lab audits are precise. We are looking for the signal in the noise. Any ambiguity in your lab results is a risk to your application. When I ask a specific question, I am not trying to pry into your personal life. I am gathering the specific data points required by federal law. When you try to elaborate or when you become emotional because you fear the implications of a question, you are fighting the process. You are creating noise where there should be signal. In a forensic audit, noise is the enemy of certainty. Pillar 2, physical or mental disorders with associated harmful behavior. The law doesn't care about the diagnosis itself, it cares about the behavior. If you have a history of harm to yourself or others, we must audit for recurrence. This is where objectivity protects you from misinterpretation. We are looking for behavioral patterns that meet the statutory definition of inadmissibility. This is not therapy, it's a technical audit. Pillar 3, drug abuse and addiction. We are looking for clinical evidence, not moral judgment. We audit for the presence of the NLRP3 inflammasome markers. Drug abuse isn't a narrative, it's a biochemical state. We use sub-millimeter precision to identify these markers during our examination. If there is a history of substance abuse, we must audit for sustainable remission according to CDC technical instructions. Data secures your future. Let's break down the I-693 stack. The law requires us to audit 3 primary pillars: communicable diseases, physical or mental disorders with associated harmful behavior, and drug abuse. Each pillar has a strict evidentiary standard. We aren't looking for a feel-good diagnosis. We are looking for lab-verified data points. Chapter 8 of the CDC Technical Instructions is our manual. It dictates the frequency of testing and the standard of evidence. We follow it to the letter. This isn't a suggestion, it is the legal framework. Any deviation is a failure. We operate with surgical precision within this framework. The 60-day rule is a forensic deadline. Your civil surgeon's signature must be dated no more than 60 days before you file your I-485. Timing is everything. Concurrent filing removes the shadow consequences of a request for evidence. We audit your file so it is ready for immediate submission. Once signed, the Form I-693 is valid for 2 years. This is your window of admissibility. We ensure the data remains robust for the entire duration. The integrity of the process must be maintained from our office to the USCIS intake. Any breach of the sealed envelope voids the forensic audit. Admissibility is a technical state achieved through procedural alignment. We audit the terrain, identify the signal, and secure your legal future. The analytical approach is to stop looking for comfort in the room and start looking for efficiency. You will achieve certainty when you align your behavior with the process. If I ask a question, answer it directly. Do not offer more information than is requested. Do not try to explain away your history. The law does not care about your narrative. It cares about the data. When you accept this, the paradox resolves. You realize that my cold objectivity is actually your greatest asset. It means I am not missing details. It means I am not being swayed by emotions that have no place in a legal file. We follow the technical instructions from the CDC. This is a forensic audit of your biological soil as it pertains to federal admissibility. These instructions are the standard of grace. We audit your immune system's memory through the vaccination record, the clinical forensic audit. The vaccination audit is not a suggestion, it's a statutory requirement. We look for metabolic sovereignty through immune protection. If your biological soil lacks these markers, we must intervene. This is process alignment. We fix the terrain to secure your future. We audit your history or use serology to prove immunity. We don't accept, I think I had it. We need the biochemical proof of your immune status. A botched exam leads to shadow consequences, requests for evidence, outright denial, and massive financial loss. Accuracy is your only insurance. When a civil surgeon misses a data point, you pay the price in delays and legal debt. Our precision prevents these shadow consequences. We have structured our office in Woodson Terrace to be a high-throughput, precision-focused environment. We don't do assembly line medicine, but we do operate with surgical precision. By treating this as a technical checkpoint, you remove the emotional burden. Woodson Terrace is a center for forensic excellence. We have optimized every step to ensure accuracy and speed. We fix the terrain of the exam itself. Once the audit is complete, the Form Y693 is sealed. This envelope is a legal document. Do not open it. Any breach of the seal is a breach of the process. A civil surgeon is responsible for providing you with a completed I-693 that is signed and placed in a sealed envelope. Accuracy and integrity are non-negotiable. Your role is to transport the sealed truth to the government. Any alteration of this document is a failure of the alignment we've achieved. You stop fighting the process and start navigating it. This is how you achieve certainty. My objectivity is the shield that protects your application. You stop fighting the process and start navigating it. This is how you achieve metabolic sovereignty over your legal future. Metabolic sovereignty is the mastery of your clinical and legal profile. By aligning with the process, you take command of your destiny. Fix the terrain. When the medical data is indisputable, the legal path becomes clear. We remove the obstacles through forensic precision. This is clinical command. We master the paradox to secure your success. We fix the biological and legal terrain in tandem. Located near Lambert International Airport, our facility is the hub of forensic excellence. We serve the sovereign seeker with no-nonsense precision. When you are ready for a professional, no-nonsense immigration exam that prioritizes accuracy and speed over sentimentality, visit immigrationexam.us. Schedule your precise, data-focused exam at immigrationexam.us today. Fix the terrain, secure your future.